Thank you for joining us on Journey to 600. Today we're going to be going over other systems, and specifically we're going to be going over gastrointestinal conditions. First off, we're going over appendicitis. So this is when the appendix is inflamed, and you could see the location of the appendix in the picture to the right. Signs and symptoms include right lower quadrant pain, and it can be determined with a pinch and inch test, McBurney's point, and palpation of the iliopsoas. You could kind of cluster these together and kind of figure out if they have the possibility of appendicitis. And if you do believe your patient does, you need to refer out immediately. Next, we have Crohn's disease, and this can occur anywhere in the GI tract and it penetrates the entire lining. Signs and symptoms include right lower quadrant pain, sudden fecal urgency. Pain is relieved by passing gas or stool, and this is considered an inflammatory bowel disease. I've included a picture to the right of a normal digestive tract and then somebody with Crohn's disease, so you can kind of see the difference between the colon, how there's a thicker wall and fistulas with Crohn's disease. Next, we have ulcerative colitis, UC for short. This is limited to just the large intestine slash colon. It penetrates the inner lining. Signs and symptoms include pain to the left lower quadrant, bleeding during bowel movements, and this is also considered an inflammatory bowel disease. Again, I've included a picture to the right, kind of comparing a normal colon and a colon with UC. And you could also use these pictures to kind of tell the difference between Crohn's and UC, which are commonly confused in treatments and day to day life and on the NPTE. Next, we have irritable bowel syndrome, IBS for short. It mainly affects the large intestines. Signs and symptoms include left lower quadrant pain, pain after eating or in the morning, but is relieved by defecation. Pain will disappear at night or during rest. Here I've included another picture just to keep up with the theme, but IBS will have abnormal contractions and bowels can get distended. Next, we have diverticulitis. This is an infection and or inflammation that accompanies a microperforation of one of the diverticula. Signs and symptoms include abdominal pain, specifically in the left lower quadrant, low-grade fever, nausea, bloody stool, and you might also find a positive pinch and inch test, just like you would with a appendicitis. So I think it's really important that we know the different quadrant pains and different signs and symptoms, because if you see positive pinch and inch tests and you have diverticulitis and appendicitis as your answer choices, you're not going to be able to just know it based off of knowing pinch and inch test. You would have to cluster your other findings to find the correct diagnoses. Next, we're circling back around to the inflammatory bowel diseases. So that includes UC and Crohn's. It puts a patient at a high risk of developing osteoporosis due to malabsorption. And I've kind of included different pictures here about the difference between the two and signs and symptoms you might see with an inflammatory bowel disease. Lastly, I'm going over peptic ulcers. So you're going to have a gall, burning pain in that central epigastric area, and your vomit is going to look like coffee grounds. So when it comes to peptic ulcers, you could have gastric, which is more in the stomach, and duodenal, which is when you get past that stomach and you're starting into the intestines. but you'll see that gastric has discomfort within 15 to 30 minutes of eating because it's in that stomach, while duodenal, it has discomfort 1 to 3 hours after eating because it has to get through your stomach and start into your digestive system. Um, Duodenal is characterized by burning and is actually improved with eating and antacids. Here I've included quadrant pain chart. There's things we didn't talk about in this chart, but I feel like they were common things I saw when I was studying for my NPTE. So I just made a quick chart. Take a screenshot, copy this, and add to it as you're learning, because keeping these quadrant panes put together is really going to help you be able to cluster and diagnose your GI conditions on your test. I also want to point out that I set up my quadrant pain chart like this, like I was looking at the patient. So, like left lower, like that would be me looking at the patient, and that's their lower left. It's not synonymous to like being on me. I don't look it that way. Everyone's different. Organize it how you need to organize it so you can remember it best. Okay, the correct answer is A. A patient is found to have pain to the left lower quadrant, and they also report that they have bleeding during their bowel movements. What type of GI issues might they have? Okay, let's go over each answer choice. So, A, that's the correct answer. You see, you will find that left lower quadrant pain and bleeding during BMs. B is IBS. You would also have left lower quadrant pain, but pain is after eating or in the morning. Patient might have cramping and bloating that is relieved with BMs, but no bloody stool. C is appendicitis. You would actually have right lower quadrant pain and a positive pinch and inch test or McBurney's test, or pain with palpating the iliopsoas. And D is Crohn's disease. This is right lower quadrant pain and relieved with bowel movements or passing gas. A patient would also have mentioned fecal urgency. Okay, the correct answer is C. All of the following produce left upper quadrant pain except. So we did actually not go over A, B, or D, but I did include them in my quadrant pain chart. Once again, these are things that I put together when I was studying for my NPTE. No one provided me with this chart, I made it on my own. So take your time, go back, learn, make a chart like this so you could kind of help remember, because this is an easy memorization question. There's nothing that this question is going to give you a way to like help you remember this. So that is my suggestion when it comes to quadrant pains in memorization. Okay, the correct answer is D. Your patient has had Crohn's disease for over 10 years. They are more likely to experience what complication from this? So, going back to Crohn's disease, what is Crohn's disease? It is considered an inflammatory bowel disease, and when that could be UC or Crohn's, but when a patient has one of these, this puts the patient at a high risk of developing osteoporosis due to malabsorption. As for weight gain and increased appetite, those are not correct. A patient is actually more likely to lack in appetite and have weight loss. And then C, hepatitis, I just threw that one in there. And that was one you should have easily marked off. You're not more likely to get hepatitis if you have Crohn's disease or not. Thank you again for joining us on Journey to 600. Please like, subscribe, and turn on your notifications so you know when we post our next video.